Hi everyone, my name is Dr. Abdullah bin Zubair, a past researcher from Mayo Clinic. Today we have a really great person who had a lot of prevalence, and he was my colleague at Mayo Clinic Rochester. We have Dr. Masum Rahman from Bangladesh. Dr. Masum, welcome to you, and we'd like you to introduce yourself.
Hey Abdullah, thanks for inviting to this meeting. I'm really grateful for the opportunity. First of all, I'm Masum Rahman. I born and raised in Bangladesh. Um, then I decided to uh, be a U.S. trained surgeon at some point in my life. Then I started my journey, and now this year, thankfully, Allah gave me the opportunity. I finally matched into categorical general surgery at Conemaugh Medical Center, Johnston, Pennsylvania. So here I am.
So, so Masoom, about your journey, I know it personally as well. When I came into the lab and you were there for a few years. So Masoom has actually done his fellowship in neurosurgery as well, and then he became a general surgery resident. So Masoom, I would like people to hear about your story by yourself.
Oh, great. Um, so first of all, USMLE journey, and particularly if anyone interested in surgery, matching in surgery, it's a great challenge, and it's a source of great anxiety. It was for me as well. So as usual, I started with my USMLE Step One preparation. On that time, I was fully focused on my USMLE Step One preparation because I knew the score is very important. However, when I did my own research, when I explored that how I can match in surgery, so my first interest was in neurosurgery. I actually wanted to match in neurosurgery, and all of my work, all of my research and clinical experiences, I tried to focus on neurosurgery from the beginning, very beginning. But later I had to switch because I applied, say, three times in neurosurgery and I did not match. And I told myself that to be a good surgeon, I need to know when to stop. I cannot keep pushing and hurting patient or hurting myself. So that's the brief story. So I started with my intention to match into neurosurgery. However, at the end, I decided to quit and match into general surgery, and finally that worked for me. So what I did actually when I did my own research, how to match, how to increase the chance of match, there are a couple of factors, and you cannot work on every single factors, but there are some fundamental factors. First of all, you need a very strong letter of recommendation from US surgeon, US trained surgeon, or surgery attendings. How to get that? So you need to work with the people, you need to work with the surgeon to get the letter. And most of the surgeon will not write a strong letter based on your observership experience. It's not possible. So then I asked myself, well, then what can I do? So what I found that many RMG, they pursue the research pathway. So I decided to pursue the research pathway. What research pathway gave to me, it's tremendous. It's a lot of things. However, it was not inexpensive. It's also expensive in a sense. Our research experience will increase your year of graduation. Research experience will put you out of the clinical context, and it can be stressful. It can affect your USMLE preparation. So it has some its own pros and cons. So, however, I would say the what research did for me, research provided me the J1 research visa. Then research through the research, I was able to secure my green card. Then research, of course, gave me the research experience, which I was able to write in my application. Of course, publications, many publications, and it depends on your productivity. Research also opens the door for connecting with other people, other mentors, other attendings. For me, it worked as well. Also, my mentor in the research, Dr. Barnes, who also helped me to get few other rotations or observership experiences in neurosurgery. So that helped as well. So I would say from research, I got visa, I got letter of recommendations from multiple attendings, I got clinical rotation opportunities, I got publications, many things, even the green card. What research took from me? Research took from me years. I did 5 years of research. The first time I applied, the time I applied first time in the residency, on that time I'm almost done with 3 or 4 years. I think 4 years of research. So it has its own pros and cons. So in retrospect, what I would do differently, I don't think I would spend too much time in the research. I think 1 or 2 years is the maximum you should be done with the research by then. Okay, do not to my fellow applicants, I would strongly recommend do not spend too much time in the research. 2 years is the maximum. Another thing I would say is start early. What I did, this is another mistake, or I would do things differently, that I would start research sooner than later. Um, but it is what it is. Sometimes it happens because not everyone from the same background. You may have to work to gather some money, to have some savings so that you can afford unpaid research opportunities. So you have to own your, you have to weigh your own risk and benefits and find a way. So what happened after 4 years of research? I applied for the first time, and I felt like it's not working. And I do not blame research totally, because my USMLE scores are not that great. I saw many people with great scores; they can easily overcome the year of graduation barriers. So when I applied, my scores was 242 for step 1 and 242 for step 2 CK. This is not the great score for surgical specialty. If you have 260, that's great. Then people will see that, hey, you are a great applicant. For some reason, residency at say residency selection committee or something, they are obsessed with USMLE score. I can tell you, I did not understand the value of USMLE score until I applied and until I saw how they think and how they interpret USMLE score. Now I can, because right now, although I'm a prelim, but I was a part of the discussion of their rank on a list or something. So what I found that scores are really important. I cannot emphasize enough. So to me, I think the way I interpret right now, the two things are most important: year of graduation and USMLE score. So I did not have those. So I applied. I did not match. Then I went for multiple clinical rotations, observerships. Again, in retrospect, I have something to say, like how to perform better in the observerships, but I don't think I did a great job. To be frank, there are so many rooms to improve. But again, you will not learn unless you make mistakes. Then I did the observerships. On the next year, I applied again, and with USMLE step 3 score. Again, I got a couple of interviews, and for my first two application, I was very determined that I don't want to do general surgery. So I even did not apply in general surgery categorical. I applied few prelim spots, and I was clear that I want neurosurgery, and I'm applying in general surgery prelim as a backup or something. So my second application, that did not work either. Then what to do, right? On that time, my year of graduation is super high, and I'm not getting into anything. I tried few preliminary residency programs outside the med cycle that did not work either. Then what I did, I tried to find a pre-residency fellowship programs. Thankfully, I interviewed in three different programs. One is University of Iowa, one is Mount Sinai, also one is Boston Medical Center. On the Boston Medical Center was not my top choice for a couple of reasons, and I end up in Boston Medical Center, and it is what it is. I think again, anyone who is interested to pursue neurosurgery, University of Iowa pre-residency fellowship program should be the first priority, because of their great track record. And whenever you see a mentor with great track record, whenever you see a research lab with great track record, I can tell you there is a reason why they have great track record. Okay, it's not a random thing. Trust in the data, trust in the science, trust in the repetition, reproducibility. So any mentor with great track record, any lab with great track record, there is a reason why they have great track record. I would say, do not take a chance unless you really have to. But again, I did not have any choice. For most of us who are the IMG, most of the time you'll not have any choice. The opportunity you get, you grab it or leave it. So you always grab it. I grabbed the opportunity. The biggest challenge was it was a 2 years of pre-residency fellowship programs, and I started my pre-residency fellowship program. That was brutal. For the first time, you are doing a neurosurgery hands-on experiences, a very difficult specialty, very difficult work environment, very busy service, very busy hospital. So it can be brutal unless you have a very supportive environment, supportive colleagues, supportive seniors. And thankfully, Allah managed all of this for me. Alhamdulillah, I cannot complain. So I survived. So for after my first year of pre-residency fellowship, I did not want to apply in residency. However, things happened. What happened? I was tracking is there any new program shows up. So what happened? A new program shows up, and they started taking application after February or something, or later part of the February. And I asked my program director that, hey, I know my commitment is 2 years of pre-residency fellowship. However, there is a one program which is general surgery. It's a new program. They are accepting application. So on that time, I applied to the one program because it's a non-conventional. It was not planned. It just popped up, and I applied. And guess what? I thankfully got the interview, and I interviewed there. And the program director, he was kind of offering me that you are a great applicant, but I don't know where I will be able to rank you in the categorical. But if you want the prelim, please rank us very high, and we will be rank you very high in the prelim. So during the interview, it was very obvious that I may get the prelim if I rank high enough. However, I decided not to rank or not to go to a general surgery preliminary program in a brand new program. Also, the program director mentioned that they will not be able to take the general surgery prelim residents into their categorical. So I did not see any hope. I did not see any prospect. But still, if you ask me a single question that between pre-residency fellowship and general surgery prelim, which one should get priority? I would say general surgery prelim should get priority unless you get pre-residency fellowship in University of Iowa and you are truly looking for neurosurgery. So two conditions: truly looking for neurosurgery, nothing else. Very dedicated, very motivated, and you got a pre-residency fellowship in Iowa. You should go to Iowa. Other than like if you compare with any other pre-residency fellowship with preliminary program, I would go to the preliminary program. Why? Because after all, it's a GME program. It has some degree of ACGME control, and the way they treat you, it's totally different. The way they will treat the hospital, the colleagues, then everyone will treat you as a preliminary resident versus a pre-residency fellow is totally different, I can tell you. And of course, that is important. That affects your the quality of education and experiences. Okay, so yeah, so I applied after my first year. Hey, Abdullah, am I taking too long? I talk too much, I know.
No,
All
no,
right.
it's perfectly fine. You're going great. I'm listening.
Okay. All right. So after my first year of residency fellowship, as I said, I applied to one program. I don't know should I count this as a residency application or not. So that was the that was the third application. Okay, I applied one residency program. I got the interview. I did very well in the interview. However, I had the impression that the program director is willing to offer only the prelim, not the categorical. So I did not actually rank their prelim program because I said no, I'm not doing this. Okay. So I did not do that. I did not rank their preliminary program. So I remained unmatched. And in that phase, I was not sad because I did not actually apply with my full strength or something. I just applied in one program. Did not work. That's fine. Next, I applied, which would be, during my second year of pre-residency fellowship. neurosurgery pre-residency fellowship. So on that time, I have very strong letter of recommendation from my neurosurgery pre-residency fellowships. So again, I was very lucky in the neurosurgery pre-residency fellowship because the way they set up my rotation schedule, I rotated in like 4 months, probably 4 months in neurocritical care. That means it's a off service. So I did not work particularly with the neurosurgeons, neurosurgery attendings who will be writing my letter, but I worked in the similar type of environment, and I got some room of mistakes. I got support to learn. So that was a great experience, which enabled the opportunity to do better when I started my neurosurgery rotation during my pre-residency fellowship. So I had an impression that I will get a very strong letter of recommendation. So I had that. So I had letter from pre-residency fellowship program. I multiple letters. I also kept my letter from Dr. Barnes from the Mayo Clinic, and on that time I don't know why Dr. Barnes almost told me what he is going to write in that letter, and man, it's a great experience.
He
I
never
almost
tells you. He never tells you. You're the only one he told.
right, yeah. So
Yeah.
he very professional. He never tells anyone that what he is going to write, but he kind of showed me like what he is going to write. Again, the amount of support I got from my mentors, my colleagues, my senior, it's unbelievable. Trust me, when I was in Bangladesh, I could not think, I could not figure out that I will have so many support, so much support from people. But yeah, of course, you have to explore. And trust me, if you feel like you're not getting enough support, maybe there is something to improve on your end. Maybe you are complaining too much. Maybe your tone is little different, a little bit frustrating. It may your speech or your text represent the frustration, not the aspiration. So I would say fix that. If you only convey the positive energy like aspiration, you are someone very dedicated, very motivated, don't complain about the uncertainty, people will of course pick you. Okay, people will help you, you will find someone, inshallah. Again, there are so many things is not in our hand, but it on Allah, and Allah will find a way for you. Okay, if you keep trust. And guess what, the only thing make things difficult for us, which is the outcome anxiety. The only thing, I would say, the only thing make make the pathway difficult is the outcome anxiety. It's unbearable. It's unbelievable. So how to overcome that outcome anxiety? Always put our trust in Allah. That inshallah something will happen good for me. So let's keep talking about the application. Okay. So that was my fourth application. I think, yeah, that was my fourth application, and I felt like the support during my fourth application was tremendous. Everyone, every attending I reached, every single person I reached, they wanted to support me. They wanted to help me. So during the fourth application, I almost decided that hey, I had something, like during third application, I applied in general surgery, and I on that time I was kind of looking for a backup plan. That hey, I need a strong backup plan because I have kids. I On that time my wife was pregnant for our fourth baby, so I cannot do that for too long. So I was okay. I was
I
convinced.
was there. I was there for the third when the third one was coming in.
Oh
I
yeah,
still
yeah,
remember.
yes, that's true. Also, there is another thing like my third baby had a congenital diaphragmatic hernia, and it was repaired by a pediatric surgeon. So before that, I had an impression that all the great work is only done by neurosurgeon, right? Unless it happened to my family, and I saw that a simple diaphragmatic repair, a simple suture, can can have so much effect, so much impact in someone's life, in someone's family. So that was very impressive. So I was kind of convinced, and I that okay, if I get general surgery, I think I would do general surgery. So during my fourth application, after my or during my second year of pre-residency residency fellowship, I applied very broadly. I applied neurosurgery. Also, I applied general surgery, and keeping things separated as much as I can. So here is the caveat. It's quite impossible to uh, to apply and show your commitment to different specialty. Why? Because during the ERAS application, you have to write something in your experience. You have to write something, say your clinical experience, your research experience, something you have to write. So when you write, and you know that the only thing will be separated specialty wise, say my general surgery application, my neurosurgery application, there is a common form and there will be some different form. The only thing it can separate is letter of recommendations, personal statement, I guess. Yeah, most of the thing you will not be able to separate. So it can affect in both way. Why? Say if you only apply to one specialty, in every segment of your application, you will say, hey, I want to neurosurgeon. This is how I will be a better neurosurgery resident. This experience help me to do this, gain this skill, which will I hope make me a better neurosurgery resident. So you have to be vague when you write those experiences. You have to be vague. So that's the caveat. It will affect both way, in both direction, because neither in none of the specialty you are telling them that you are very specific, you want to do this, and guess what, people love that. People love to hear that you are very specific, very focused to their specialty. Okay, so this is one thing, and I felt it was very challenging to keep it neutral. Okay, then the personal statement, I could make it two different personal statements. In general surgery, of course, I had to defend myself, like why I decided to take a different route. And of course, there will be so many people, they will not be okay with that. I can tell you. I interacted with so many people, so many residents, so many attendings, and many of them raised a question. So you have not been interested in general surgery. This is something new for you. That means you do not have general surgery clinical experience. So this is how those are the questions. I appreciate their questions because those are the honest questions. But trust me, many people will see general surgery as a backup plan, and nobody wants to be a backup plan. Who wants that? Nobody wants to be your backup plan. Nobody. So it's very hard to convince them, and it become obvious when someone see that you are pursuing neurosurgery for so long. You did 5 years of research in neurosurgery, 2 years of pre-residency fellowship in neurosurgery, then general surgery. I mean, you did not switch to general surgery for 7 years. So it becomes so obvious that you do not want general surgery, or general surgery is your backup plan. Okay, that's why pursuing something too long can eventually affect your backup plan. Say, people may ask, so why you continue neurosurgery research for 5 years? You could switch your lab. You could switch to a general surgery lab after 1 year, after 6 months. I get that. I understand you were an IMG and you applied and you got this opportunity, you grabbed this, then why you did not switch, right? So people may ask in this way. So um, I I felt that it's tough to convince general surgery people that hey, I'm interested and please give me the opportunity. So I had someone who knows me very well at Conemaugh at my current program. One of the resident at Mayo Clinic, Dr. Desmond Brown. I'm not sure if Abdullah, you met him or not. So
Yeah, yeah,
Dr.
I did. Yeah, I did. I remember
Mhm.
him.
Okay, so Dr. Brown, I call him Des. He was my friend in the Mayo Clinic. So Des was here, and Des was doing like say part-time on-call something. And I told Des that, hey Des, this is my application and this is my interview so far. I got interview from Emory, I got interview from University of Connecticut. Also, I got an interview from. I also got another interview from Berkshire Medical Center general surgery. Then I got general surgery interview from Conemaugh Medical Center. Des was so excited, and there was I have a friend from Bangladesh who is currently PGY 4, and she was on PGY 3 on that time, and she forwarded my application to the program director that, hey, Dr. XYZ, would you please look at this application? Then I got the interview, and after interview, I contacted Dr. Brown, and Dr. Brown helped me to, he of course advocated my application. He vouched strongly for me, and I was hoping on that time that I would match in neurosurgery because both of the neurosurgery program, University of Connecticut, University of Emory, I had so much positive vibe that they are going to rank me, and they told one of my attending.
And University of Connecticut, was Dr. Siddiqui the program director there when he
No, no, no.
interviewed you?
Dr. Siddiqui was University of Missouri.
Yeah.
University of Connecticut, it's Dr. Ketan Bulsara.
Okay.
So, my attending in Boston Medical Center, they also communicated with the place I interviewed, and they had the impression that they are going to rank me. Of course, they did, but at IMG, it's difficult. They will not. They will typically not rank you as rank to match. Uh, so, and those are the very good neurosurgery programs. So, I did not eventually match in neurosurgery. However, I was strongly hoping to match in categorical, but I was shocked that I did not match in categorical in Conemaugh, but I got the preliminary. Uh, but what I grabbed that opportunity. I was happy because Conemaugh has my current program, Conemaugh Medical Center. It has a great track record of taking their prelims. Okay, so they have been doing this for so long. One of the attending I met, he did his residency early 90s, and he was the prelim too. And after prelim, he did his categorical here. So it has a very established track record of taking their own prelims. That made me so hopeful. Okay. Then I started working every day, every single day, kept up myself motivated, interested, happy, grateful, so many other things, willing to learn, easy to work with. Um, those are the characteristics I always wanted to demonstrate. I wanted to see in myself actually. I don't care about what people think. Uh, I always try to focus on myself that what I want to see in myself. So I think those are the qualities I always wanted to see within myself. And finally, it worked. So I know I took so long, but I almost shared all of my experiences.
So when you matched this cycle, how many interviews did you get after so many? This was your sixth match cycle, right?
So it was my fifth match cycle.
So how many interviews did you get this cycle around?
So my fifth cycle was the worst one, and because this time the only interview I got from my current program. And again, I have another impression that once you are in a prelim program, there are so many programs they are not willing to interview prelim.
Yeah, yep, that's right. Because when I talked to Dr. Rivera about my wife, she said that we don't take prelims from other programs.
Hmm. That's very
Although
true.
Rivera used to, like Rivera, I remember she used to praise me due to my surgical skill, but
Hmm.
this has like an implementation because if someone wants, like they have the impression that if you're a really good prelim, your own program is going to keep you.
Yep, that's true. That's very true.
So,
And also another thing, like maybe you had some issues. That's why you did not match in the first time. Uh, and this residency application is meant for the medical students, MS4 medical students. So there are so many programs they only want to keep the sample within that specific group of people. Okay.
okay, Masum, so you explained every single thing.
Yeah,
So I think I don't even have questions to ask you.
I know.
Yeah, so I'll just ask a question that what is the favorite memory we had with each other during our time at Mayo with Dr. Burns Lab?
Between us, you and I, or what?
Between us.
Oh, okay. So I think we have a great memory. Remember, we went to Minneapolis. We were driving Minneapolis, and you guys were stuck in Rochester for so long. Okay, and being as a family man, a married man, it's a great opportunity when I get. It's a great opportunity to hang out with my own friends. So I told my wife, "Hey, I will be late today, and I have to go to Minneapolis because I have to really help." And I make a different impression that I'm going to help someone who is so needy. I'm sorry for that. Actually, of course, you are not that type, but I made an impression to her to get her empathy and the permission at the same time. And I had the permission to go outside and spend some time with my friends. It was so much relief and it was so good experience. And I saw that you and what is the other girl's name? I forgot her name.
Ravantika.
Yeah, so you guys are so happy. I mean, it was a great time. I think that was the sweetest memory I can remember.
And what was the best memory during the lab, in the lab?
In the lab, I think all those procedural days when we did the animal surgery, those are the best memory, I think. Yeah.
Especially with Kevan. If you
Yeah.
remember the mice. You remember the mice, what happened to it? We went out
Yeah.
for 2 minutes.
Yeah. Yeah.
So
Those kind of things.
Dr. Masoom, well, what I feel about you that I've seen your journey face to face for a longer period of time. Though I was not as long with Dr. Burns' lab as much you were,
Mhm.
and you had some chances in between when I told you that you can actually come to the colorectal surgical department. You could have shifted you to yourself to general surgery if you remember that.
Right. Yeah, that's true.
But it was more of the consistency,
Mhm.
and I'm really happy that it paid off for you. And most of the people they get depressed,
Right.
especially when they think that hey, it's our third cycle, it's our second cycle. Well, you're a legend. It was your fifth cycle.
Right. So I can tell you the truth. Okay. The truth is when you guys see someone who is persevering, persistent, like something, you think they may be different or they maybe no. I think I felt the same way. There are so many nervous. There are so many days I felt so down, and I felt like I'm about to leave. No, I. There are so many days that I felt I'm quitting. This is not for me. Okay, there are so many days I felt like I'm giving up. There are so many days are like that. But yeah, I think the control of your own anxiety and own stress is the biggest skill what someone can have. And another thing I realized that all of my feeling, all of my anxiety actually origins from my own thought. So if I actually work on my own thought process, that makes me well.
Thank you so
That's
much,
the
Dr. Masoom. Thank you so much for being with us today. And this has been a splendid time, and we wish you very best of luck for your future endeavors.
Thank you so much for arranging this.